And while the banking crisis of the 1930s gave rise to the modern national city bank, another has now caused its demise. Today you hear a lot about green shoots in the economy. The term refers to signs of economic activity, and there are many. In the political context, too, I think there are green shoots today, just as there were in each of these past eras. Teddy Roosevelt was part of the progressive era, the first one of this century. I would argue we're now in the fourth, that gave rise to the Federal Reserve System and the Food and Drug Administration. FDR's New Deal transformed our country, the second progressive era, with the advent of the FDIC and Social Security and massive public wealth, public works, and Hugo Black's labor laws. In the Great Society programs of Bobby Kennedy, the third progressive era, and Rosa Parks' days ensured that the poor and the elderly among us would not be impoverished by crushing health care costs. Their work, of course, is unfinished. This Congress will do its level best to reform the banking laws that have served us well over the past century but are no longer sufficient to the task. We must tackle a new challenge, finding clean energy sources of sufficient scale before we destroy the planet for our grandchildren or mortgage our future to potentially hostile countries. And we must find a way to ensure affordable health care for all Americans. Why? We've muddled along for decades. Why not continue to do so? 3 reasons. Number 1, we must cut costs of health care all up and down the system. Second, we must protect consumer choice of provider. If you like where you are in your health insurance, you stay where you are if that's what you choose. And third, we must ensure quality access for the uninsured, a number, of course, that's growing in this economy. Our economy is coming under ever-increasing global pressure. We can't afford the incredible inefficiency and added costs of our current health care system. Healthcare today, in many ways, defies the laws of economics. Put a lot of doctors in a given area, and instead of supply driving down prices, prices for consumers tend to go up. Consumers have very little reliable information. Efforts to improve that information can touch off a political firestorm, as when the drug companies get scared that somebody might tell people that the new expensive drug that they are selling is no more effective than the older, cheaper one that they were selling. In many markets, there's almost no competition among insurers, and when insurers do compete, it's often on the basis of denying the very service that people thought they had paid to have delivered. Additionally, the costs of health care threaten every low and middle income family in America and every self-employed or small businesswoman or man trying to do right by his or her employees when it comes to health care. In the last 2.5 years, I have conducted about 140 roundtables around Ohio, gone into each of the 88 counties, met with cross-sections of people in a community, met with veterans, roundtables of veterans only, of farmers only, of small business people only, and as I said, cross-sections in many communities around the country, all around the state, all of every one of these roundtables I hear of struggles from business people, from employers, from employees, from uninsured people, from all kinds of people hear of their struggles with health care and health care costs. Now forget the overheated rhetoric about earmarks that we hear coming out of the national political scene over and over again. The bigger waste in the federal budget is the money we pay for an inefficient health care system. Nearly 50 million Americans are uninsured, yet we spend $2 trillion on a system that breaks bank accounts and shatters hearts. The miraculous advances in medicine made at places like UH and the Cleveland Clinic and at Metro Health are the envy of the world, but our delivery system is its laughingstock. An unemployed parent must fight to provide health care for a child. A retiree must drain her retirement savings because of spiraling prescription drug costs. I hear almost daily from Ohioans choosing between medicine and food, choosing between rent and health care, and hearing of seniors rationing pills, cutting them in half, taking them every other day, whatever they can to save money. Healthcare is a business, but it can't be a business as usual. My father was a small-town doctor in Mansfield, Ohio, a city of 50,000 people. He made house calls. He took care of people regardless of their willingness to pay. He would accept whatever people offered him for his services in so many cases. These days are not behind us in some nostalgic past. Let me tell you 2 stories to sort of illustrate that. One about my mother and one about my hometown. My mother, as many of you know, and many of you were very, very, very kind about her in her declining days and after her death back in February. My mom, right before her death and right before she got sick in November of 2008, she ran a senior citizens levy, which of course passed because she was running it. She has great political skills, had great political skills. She ran and then in mid-December she got sick. She was in the hospital for a few weeks in Mansfield. Then the last 3 weeks or so we had her at her home in Mansfield. And Connie and I and Bob and Catherine and Charlie and Ann were there pretty much every day these most of those last 6 weeks. And my mom was talkative and pretty alert through most of this time. About a week before she died, and I would add that the hospice home care workers are just incredible. And many of you in this room have been with a dying relative or very good friend and know what hospice does and how mostly middle-aged women mostly middle-aged, well-trained women nurses and hospice workers take care of people whom they don't even know and show such incredible empathy. It's just an amazing phenomenon. But about a week before my mom died, she asked me to sing a song to her out of our Lutheran hymnal. So I went and got her the hymnal in the other room and sang the song, which unless there's unanimous request for this, I won't repeat. I sang the song "Beautiful Savior." For those of you that are Lutheran might know that song, and I sang about 3 verses of it and put the hymnal down. And my mom smiled and said, "That's really nice, Sherrod." And then she hesitated and she said, "But you really do sound better in a group." And the mother's lessons sort of never stop, but the lesson also was we all sound better in a group, and more about that later, about working together to change things. The second story about my hometown was again brought to me by my mom. Back about year and a half ago, I went to a program at an old grade school in Mansfield. It's now a community center. 2 physicians started this program called the Community Health Access Plan or Project. I can't remember. CHAP. And CHAP took 2 sections of Mansfield, Ohio. Mansfield is a sort of a typical typical Midwest industrial town, not much different from many industrial towns in America. And there is a fairly poor black section of town, a fairly poor Appalachian white section of town. And in both these zip codes, and they sort of were divided that way, each of these zip codes had some of the highest birth weight baby rates. Had some of the highest low birth weight baby rates of anywhere in the state, about 4 times the national average. And so these 2 doctors in this practice, in this organization, CHAP, hired several young African American women and young white women who lived in these neighborhoods, paid them only about $10 or $11, $12 or $12 an hour. It was hard to find funding for this because it doesn't quite fit into our programs. And these young women were either high school graduates or a GED. They had no more education than that. They trained them to be community health workers, which is something I knew very little about. It's actually licensed by the Ohio nurses, by the Ohio Department, or by the Nurses Board in Columbus. And these young women went out and met with the pregnant women in the neighborhood that they could locate, and they lived in the neighborhood, so they knew most of them. Within 3, they taught them nutrition. They got them into OB-GYNs. They had the kind of medical care they needed, funded mostly in that case by Medicaid. In about a 3-year period, they dropped the low birth weight baby rate almost to the national average. So when you think about stories like that, imagine if we can replicate stories like that. We can replicate programs and ideas like that at very little cost. Think of the savings humanitarian ways. Think of the savings in dollars for the cost of 1 low birth weight baby versus the cost of hiring these young women and providing their care. And one of the great parts about it is something else that comes out of this. These young women, I met with them, probably 6 of them afterwards, and just listened to them tell their stories. And I said, you are heroes. You have saved people's lives, and you're 23 years old. And you could just see that some of these women who would not have had this chance, some of them will become RNs, some of these women will become MDs, some of these women might run a hospital. I mean, they're people that clearly have been given opportunity, and they know how to make healthcare work for so many people. So there are green shoots in our healthcare system, but we need to make important and lasting systemic changes to address the fact that most Americans are only 1 pink slip away from becoming uninsured. We need to protect what works. We need to fix what's broken. Over the course of the City Club's life, each time healthcare reform is introduced, the cries of government takeover and socialized medicine were heard.